Hey guys, it's Kana, a Japanese vet. In today's video, I want to share the latest information of coronavirus, like the relationship of coronavirus with dogs and cats, and the reality or the prevention for the novel coronavirus. I know you have tons of questions like, do they really get infected? What if I got infected? Or what exactly we should be careful for them? At first, we were so powerless against this virus, but more and more things are getting revealed day by day. So, let's get ready with me today to kick out the coronavirus. Now, I want to start with a question. Do you think coronavirus was irrelevant to dogs and cats before 2019? The answer is no. Actually, cats have been suffered from another coronavirus for decades, which causes more severe disease with much higher mortality than COVID-19. Generally, cats have two kinds of coronaviruses. One is feline enteric coronavirus, FECV, the milder one, which is usually asymptomatic, and many cats are carrying this virus without knowing. The other is mutated form of FECV called feline infectious peritonitis virus, FIPV, and this is the one which is severe. Unfortunately, we don't have any vaccines nor treatments for these two coronaviruses for cats. Meanwhile, dogs also have two kinds of coronaviruses: canine coronavirus, CCOV, and canine respiratory coronavirus, CRCOV. CCOV could cause digestive symptoms like vomiting or diarrhea, especially to puppies, and we have vaccines for this one. On the other hand, CRCOV, which causes kennel cough, there's no vaccine for this one. The canine vaccine, which includes CCOV, prevent only CCOV. It doesn't work for canine respiratory coronavirus, nor the novel coronavirus. Some people think getting canine vaccine prevents your dog from COVID-19, but it's so not true. So if you can't get your buddy vaccinated because your vet is not dealing with non-urgent cases right now, you don't have to worry about it. Now let's move on to the next topic. Here is the list of positive cases in animals. There's 2 dogs and a cat in Hong Kong. The first dog died after getting the positive result, but he had shown no signs of COVID-19, and medical sources believed that he had died from old age of 17 years old or some underlying illnesses. The other dog and the cat were asymptomatic. Several cases are reported in America: 1 dog, 2 cats, 4 tigers, and 3 lions. All of them had flu-like syndrome and are getting better now. In Belgium, 1 cat had developed diarrhea, vomiting, and respiratory symptoms, and these symptoms subsided after 1 week. On the other hand, there's fatality in Dutch mink farms. Did they get really infected or developed COVID-19? Here, Harbin Veterinary Research Institute had several experiments and reported that novel coronavirus replicates poorly in dogs, pigs, chickens, and ducks, but efficiently in cats and ferrets, which means cats and ferrets are more likely to get infected than dogs and other species. And they also reported that the virus transmits in cats via respiratory droplets. Recently, University of Tokyo and University of Wisconsin also reported that the novel coronavirus can be transmitted between cats, and they found the infected cats no symptoms. Meanwhile, Harbin Institute's latest report was that almost 15 cats out of 100 living in Wuhan had the antibody for the novel coronavirus, which means 50% of cats in Wuhan had already infected even though they didn't have any clinical signs. So you'll be like, okay, so cats should be more careful and should stay home so that they can get social distanced from other cats. But wait a minute, you said that dogs are less likely to get infected. Then why the dog in some countries had positive results at PCR tests? Well, about that, it's a bit gray area, because if you get some samples from a hygiene mask of a patient and do the PCR test, you might get a positive result from it. But it doesn't mean hygiene mask is infected, right? So the dog cases need to be get further investigated. Then, what makes differences in susceptibility between dogs and cats? It is said to be ACE2 receptor. ACE2 is angiotensin converting enzyme 2 and has some roles like regulating blood pressure or fluid volume. Sounds like ACE2 has nothing to do with this novel coronavirus. But actually, this ACE2 receptor is the key of the corona infection. When the novel coronavirus gets into a cell of our body, the virus uses the ACE2 receptor just like as a doorknob, and the difference of the structure of ACE2 receptor affects the susceptibility. In other words, the novel coronavirus prefers the cat's doorknob to dogs. On the other hand, IDEXX Veterinary Diagnostic Lab started to have the screening test of the novel coronavirus. So far, they collected 5,000 samples of dogs, cats, and horses from America, Canada, South Korea, and European countries. They performed PCR tests, and all specimens showed negative results. This supports the expert opinion that reverse zoonotic transmission from humans to animals is uncommon, but it's still under investigation. So I'll let you know when we get new announcements. Anyways, there are some reports that it's saying cats and ferrets might have higher susceptibility than dogs. It doesn't mean cats and ferrets always show some symptoms after infection. They tend to be asymptomatic or flu-like symptoms at most, and most of the time subside after 1 week. Then how they get infected? Basically, it's you who give the coronavirus to them. The research suggests that zoonotic transmission from pets to human is extremely unlikely, while your cat can get infected. In fact, if your cat is infected, the chances are your cat caught the coronavirus from you. So about the prevention for furry family, the most important thing is to prevent ourselves from coronavirus. Obviously, we should always do gargling and hand washing, but it's also important not to bring something with virus into our house, like a jacket, a bag, or shoes. In my opinion, one of the reasons Japan is having less patients than US or European countries is our custom of taking our shoes off before entering our house. So I would recommend to take off your shoes at the entrance and disinfect or dry in the sun your belongings, because UV can kill coronavirus. And please do care about the social distancing, not only to humans but also to animals. I know you want to play with stray cats or the dog next door, but let's not do it for now. Our hands are much dirtier than you think. So let's try to wash our hands before and after you touch your furry friends. As for the cats, we should keep them inside of our house so that they can keep distanced from other cats, since there is some reports suggesting the virus transmission in cats via respiratory droplets. I also believe that bathing or wiping up pets is effective for prevention. S.G. Johnson performed the test, like prepared a stainless board coated with virus and wiped it with two kinds of papers. One is a paper with water and the other is a paper with alcohol. Both of the paper reduced the number of the virus on the board from 100% to 10%. However, the paper with water caught the rest of the virus here and could be the infection source, while the virus on the paper with alcohol were almost dead. So if you want to wipe your pets with water, make sure you don't wipe randomly. Always wipe in one direction, and each row use new paper or new surface of the towel if you don't want to spread virus all over the pet's body. So there's couple things what we can do for prevention, but thinking only about prevention is not perfect. Everyone could catch the novel coronavirus despite of practically perfect preventions. So now let's think about, what if I caught it situation? What I want you to do first is listing up the pet clinics or friends who can take care of your pets just in case you get hospitalized. And if you get treatments at your home and have nobody to look after your pets, of course avoid close contacts like kissing or sharing foods or something, and always wash or disinfect your hands before and after taking care of them or touching them. And also you have to keep them inside of your house until you get fully recovered. Now let's move on to the pet healthcare. We have to be sensitive to our pet's condition as well. Here's what you should monitor for them every day. First, digestive condition. Make sure they don't develop vomiting or diarrhea. And second is respiratory condition. Coughing, too much sniffing, or rapid and shallow breathing. Cat's cough might not be what you think it is. It sometimes sounds like this. So if you find something different, take video and show that to your vet. As for the breathing, in general, dogs and cats have a breathing rate of between 15 to 30 breaths every minute while sleeping. After checking all those signals and you think that there's a possibility that your pet might cause the novel coronavirus, it's better to call your vet first and ask for the instruction before visiting. Lastly, I want to tell you the best information about the special treatment. The special treatment that boosts your immune system and reduce stress, anxiety, and pain level is oxytocin, which is called love hormone. Recently, it was proved that oxytocin is highly secreted when you and your body gaze at each other. You know what? If you're too anxious or too nervous, that would make your pets feel uneasy, and they would easily develop diarrhea or idiopathic cystitis from stress. So don't get too nervous and let's stare at each other. If you don't have any furry friends with you right now, you can also secrete oxytocin by watching cute videos of adorable animals. I hope this video made you feel a bit relieved and much healthier. I appreciate your likes or subscribes. Thank you so much. So hope to see you guys soon. Sayonara!